Hi, my name's Rhiannon and I am one of the clinical trainers at Lynton, and I'm going to talk to you today about ResurFACE, which is a fractional laser. Just going to introduce you to the clinical training team. If you do have any clinical inquiries at all, whether it be about a specific treatment or medication, please do get in touch with us. The email address is clinical@linton.co.uk, which you can see at the bottom of your screen, and we will try our best to get back in touch with you as soon as we possibly can. Now we're just going to start by looking at the history of skin rejuvenation. So when we're talking about skin rejuvenation, we're looking at anti-aging and maintaining optimum skin health. So with skin rejuvenation, you've got your fully ablative resurfacing, which is using lasers such as CO2 lasers or erbium YAG. And they are considered to be the gold standard for skin rejuvenation, but with fully ablative resurfacing, there does come with significant side effects. So often it's a medic that needs to be carrying out these treatments. Clients need antibiotics and antivirals following the treatment, and it can take quite a long time for the skin to heal. You've then got non-ablative procedures such as using IPL, long pulse lasers or radiofrequency, which are great for improving the general skin tone and colour, but only limited results are seen with lines and wrinkles. Fractional technology was introduced in 2004 to combine the best of both worlds. So with fractional lasers, they're not quite as aggressive as fully ablative lasers, but they're fantastic for acne scarring, general stretch marks, and overall skin rejuvenation, including fine lines and wrinkles. So if we're comparing various skin rejuvenation options, you've got your non-ablative lasers, IPLs and radiofrequency that have significantly low downtime. If anything, you've got possibly a little bit of redness, a little bit of erythema for an hour or so after the treatment, and that's about it. But with regards to clinical efficacy for collagen, they're not the best, they're not the strongest. Further up, we have chemical peels, which have a significantly longer downtime, but not always the best results. Results can be very sort of hit and miss with chemical peels, but you do get significant downtime with certain chemical peels. We then have your fully ablative lasers, such as your CO2 and your fully ablative erbium YAGs, which you can get fantastic results. They're considered to be the gold standard for skin rejuvenation, but like we said earlier, you've got significantly high downtime, and those sort of treatments can actually be quite risky. Fractional technology was introduced to significantly reduce the downtime of fully ablative lasers, but you can still achieve fantastic results. Not quite as good as your fully ablative. You need a few more treatments than that, but fantastic results, which we are going to see at the end of this presentation. Now, when we're looking at fractional technology and the ResurFACE laser, we are targeting water. So we're looking at water absorption. Now, water absorption starts at around 1,000 nanometers, but anything below 2,000 nanometers isn't enough water absorption to cause ablation. You just get quite a nice heating. Now, we need to heat up the water in the tissue to ablate the tissue. So it's heating up the water to the point that it vaporizes and takes a little bit of skin with it. Now, with the ResurFACE handpiece, ResurFACE is an erbium YAG, and it sits at 2940 nanometers. So it's got a fantastic water absorption at this wavelength. And what happens with the ResurFACE laser is, as we pass that laser over the skin, it's targeting the water, it's absorbed by the water, and it heats up the water to a point that it actually vaporizes the water and ablates some tissue with it. Now, at 2940 nanometers, the ResurFACE handpiece, there is no melanin absorption at this wavelength, which means it's suitable for use on all skin types. It's just that darker skin types, because they are more prone to pigmentation changes, such as post-inflammatory hyperpigmentation, we're going to need to be a little bit more cautious. So we don't go in quite as aggressive on darker skin types. And certain clinics will often use use pre-lightening products alongside the treatment for darker skin types to possibly reduce the risk of post-inflammatory hyperpigmentation. Now, looking at what fractional laser is and fractional photothermolysis, we have basically got one laser beam and we've split it up into lots of little ones. So rather than treating an entire area of skin and sort of fully ablating the skin, we've just split up that laser beam into lots of little ones. So actually, when we pass the laser over the skin, we're just putting microscopic holes into the skin, and we're actually only treating about 20% of the skin surface with fractional lasers. And what happens is, as we put those microscopic holes into the surface layers of the skin, it removes some tissue, which is where the resurfacing aspect comes in, but it also signals inflammation from the epidermis into the deeper layers of the skin, which is what triggers the collagen production and wound healing response. So like I say, we're only affecting and treating around 20% of the skin surface with ResurFACE laser, and that surrounding uninjured tissue, which is approximately 80%, means that the skin can heal a lot quicker. Now, with ResurFACE, the epidermis does remain intact, so it significantly reduces the risk of possible infection. But like I say, as we put those microscopic holes into the skin surface and give that resurfacing aspect, it then triggers inflammation to the deeper layers of the skin, which then signals wound healing. So that wound healing, in turn, stimulates more collagen and elastin production. Now, we're just going to compare a few ablative lasers. So obviously, we've got your fully ablative resurfacing lasers, which are considered to be the gold standard for skin rejuvenation. But like we looked at earlier, there's a very high risk of side effects. The treatments tend to be very, very painful. You need anaesthetic, antibiotics and antivirals following the treatment. There's quite a high risk of possible infections and risk of scarring, and what a really common side effect is post-inflammatory hyperpigmentation. But as well, often the client can't or doesn't want to go outside following these treatments. So generally with fully ablative lasers, because you are pretty much getting rid of 100% of the skin surface, very high risk of infection, clients cannot leave the house for a good 2 weeks until the skin's fully healed. Although you can get fantastic results, like I say, it's just medics that can carry out fully ablative lasers because they are quite risky and quite painful. Whereas when we're looking at fractional laser, we're only treating a small percentage of the skin surface. So we're only treating 20% of the skin surface with fractional lasers. With fractional lasers, it means that we have got more flexibility of use. They can be used generally anywhere on the body within reason. And you've got a significantly lower downtime because we're not removing 100% of the skin surface. We're still leaving some of the skin and most of the skin intact, and it remains healthy, so it's able to heal those holes that we've put in the skin a lot more effectively and a lot quicker. With fractional laser treatments as well, treatments tend to be safer and more comfortable, and you don't need anaesthetics with ResurFACE. Your main indications when using fractional 2940, which is your ResurFACE laser, it's great for improving skin texture, it's great for congested skin and general dyschromia, so that sort of uneven skin tone looks quite dull and needs quite a bit of a boost. It's great for mild lines and wrinkles, various scarring, whether it be on the face, neck, hands or décolleté. So with ResurFACE, you can use it anywhere on the body. And like we said, you don't need any anaesthetic for this treatment. So when we're explaining ResurFACE to the client, we have got one laser beam, we've split it up into lots of little ones. And as we pass that laser over the skin, we're putting microscopic holes into the skin surface. Once we put those holes into the skin surface, it triggers inflammation from the epidermis into the deeper layers of the dermis, which again triggers the wound healing response. So when we're looking at triggering the wound healing, it stimulates more collagenesis and the production of elastin as the skin heals itself from that original wound. So as well as stimulating more collagen and elastin, we also get that resurfacing aspect as we're putting those microscopic holes into the skin surface. So with ResurFACE, it's fantastic again for skin texture, general lines and wrinkles, scarring and stretch marks. Now, as well as the usual consultation and consent, there's a few things that we need to make our clients aware of during a ResurFACE treatment. So it is going to be a little bit uncomfortable following the treatment. So during the actual treatment, it doesn't feel too bad. But following the treatment, it could be a few minutes later, it could be 10, 20 minutes later. But there can be a degree of discomfort where the skin can feel and look sunburnt following the treatment. Now, cold compresses, cool water is the best method to help alleviate any discomfort from this treatment, because it does feel like mega sunburn, which is completely normal. We can get quite a bit of swelling, which is more common over the cheek area. Does usually resolve within a few days, but again, cold compresses and advising your clients to sleep on more raised pillows if they're having the face treated can significantly help with any possible swelling. Redness can be apparent for a few days following the treatment, which again is completely normal. And the skin can feel rough the following few days, and it can take up to 10 days for that skin roughness to fully flake away. There is a possibility of pigmentation changes following this treatment. So like with any laser or IPL treatment, it's essential following the treatment, and they must be wearing their SPF 50 at all times, and ideally just completely avoiding UV exposure following the treatment to reduce the chance of any pigmentation changes. There could also be a slight grid pattern once we have treated, which usually only lasts a few days, where you can almost see the dots, and as the skin is flaking and the roughness is coming away, you can see that slight grid mark. And on extremely rare occasions, because we are putting heat into the skin, there is a possibility of blistering and infection, although it's extremely rare for this to happen. Some areas that we just need to be a little bit more cautious with is obviously treating darker skins. So darker skin types are more likely and they're at higher risk of post-inflammatory hyperpigmentation. So we're going to treat them a little bit more cautiously. We're not going to go in quite as aggressive as we would a lighter skin. And you could potentially put your client on pre-lightening agents to decrease the risk of post-inflammatory hyperpigmentation. We're also going to be more cautious when we're treating off-face treatments, purely because the skin might be a little bit thinner and healing time may be a little bit longer off the face. So we're just going to treat or perform these treatments with a little bit extra caution. We're not going to go in quite as aggressive. We also need to be aware of clients who suffer with cold sores, so clients who have the herpes simplex virus. There is a possibility that this treatment could activate cold sores, and it's essential that clients get any post-treatment cold sores treated. It could be that if they are prone to cold sore outbreaks, they go on their antiviral medication before they start the treatment to reduce the risk of possible cold sores. For all treatments, clients are going to be wearing goggles. So for any facial treatment, clients are going to be wearing the full blackout goggles to protect their eyes from the light. Now, with the treatment procedure, it's essential that we cleanse the skin, but we must make sure that the skin is completely dry. Because with ResurFACE, it's targeting water. So if we do have any excess water on the surface of the skin, the treatment is not going to work that well. So we need to make sure the skin is completely blotted dry before we apply the laser. We've got a choice of either gentle or a deep application, depending on what we're treating. We're going to pop the goggles on for your client, and you're going to wear goggles. And you have got the optional air cooling. So if you have got cryos, potentially you could use it. I don't tend to use cryo anymore. It's a lot more comfortable for your client if following the treatment you apply cold compresses. and you can apply cool water. It's a lot more comfortable when the heat does come. Like I say, it does feel and look like sunburn. Now, with your treatment technique, we're going to make sure that we're holding the handpiece perpendicular to the skin and the spacer is in full contact with the skin at all times. And as we fire the laser, you will be able to see small white dots on the surface of the skin as you've treated. Now, with this treatment, you can overlap with the shots. And like I say, you will see those little white dots where you've treated, but as soon as the skin rehydrates, those dots will completely disappear and their skin may just be quite red, quite pink and feel quite hot following the treatment. You've got various treatment parameters, and depending on what you're treating will depend on whether you're using your gentle or deep settings and how many passes or pulses you do. So generally speaking, the stacking is the number of pulses that you will see on the screen. So the higher the number of pulses, the deeper that laser is going to go. So we tend to use a higher number of stacks when we're targeting scarring, so acne scarring or deeper lines and wrinkles. Whereas if we are doing a general brightening treatment, we don't need to use as high stacks. So we can just stick to 1 to 2 stacks, but do more passes. So we're just doing a general resurfacing. Following the procedure, it's essential that we cool the skin. So like I say, cold flannels, cold compresses are by far the best way. From personal experience with this treatment, it's a lot more comfortable. And it's completely normal for the skin to look and feel sunburnt, potentially for a few hours, up to 24 hours following the treatment, possibly even longer. It's completely normal. We don't want clients to be applying makeup, ideally for at least 24 hours. And if they are putting makeup on after this time, ideally minimal makeup. Treat again like sunburn, so avoiding further heat treatments such as steam rooms, saunas, hot baths and showers, especially with this treatment. And following 24 hours, because we have put holes into the skin, we do recommend that the client leaves it 24 hours before they put any products. Light Soothe Serum is brilliant for hydrating the skin. So following this treatment for the first few days, up to 7 to 10 days, the skin will feel quite dry, tight and dehydrated. So you can, they can apply Light Soothe Serum and as much moisturizer as they want to following this treatment. Again, we want them to be avoiding UV exposure and they must be wearing SPF 50 every single day, even when it's cloudy. So remember, it's sunlight that does the damage, not sunshine. Redness is completely normal and can last 2 to 4 days, and skin will probably feel quite hot and sunburned for 24 hours. From day 3, this is when the skin's going to start feeling and looking quite dry and flaky with that bronzed appearance. The best way to reduce this is just keep applying moisturizer. So avoiding picking it, just let it flake off by itself, but plenty of moisturizer will really help calm that tightness. Swelling is completely normal and almost expected. It is temporary and sleeping with their head elevated can potentially minimize that. But generally, clients are going to need a course of treatment, so that's 4 to 6 sessions. And if you're carrying out gentle settings, it's 1 every 2 to 4 weeks. Or for deeper treatments, we're looking at 1 treatment every 4 to 6 weeks. So post-treatment, just to clarify, they're going to get that immediate skin shrinkage on day 1. So the skin is going to feel a lot tighter immediately following the treatment. The epidermis is fully healed within 24 to 48 hours, but that redness can last 4 to 8 days, with results and the skin completely healed within 10 days. But new collagen will form 1 to 3 months later. So like with any collagen treatments, the more sessions they have, it is an accumulated effect, and the more collagen and the better results are going to be seen a few months later. You can see immediately after the treatment here, skin is quite red. On that photograph on the left-hand side, you can actually see where shots have been missed. So it's really important that you do overlap your shots to make sure that you get a more even treatment and a more even redness. Like I say, that redness can last 24 to 48 hours. We can get some problematic symptoms. So if your client is worried about anything, if they have any of these symptoms, do make sure that they're getting in touch with you. It might be worth just keeping in contact with them to make sure that they are all feeling okay. But these problematic symptoms are extremely rare. But just looking at some results, so you can see there after 3 fractional laser treatments, her general skin texture and scarring has significantly improved, as well as some finer lines and wrinkles around her eye. You can see with this client, she was quite a slim client. She followed a fantastic lifestyle and diet and exercise, but she just had this sort of mixture of stretch marks and sort of skin laxity, and that was only after 2 sessions and just above her tummy button. Absolutely fantastic results there after only 2, so they would continue to get better. You can see this lady after 3 sessions between her eyebrows, fantastic reduction in those deeper lines. And scarring, so this is post acne scarring, where you can see that sort of on the cheek, those sort of marks have significantly reduced. The skin also looks significantly brighter as well, and that was after 4 sessions. That was approximately 6 months after the 4th session. So you can see results do continue to improve. Again, you're looking at more texture here. So after 3 sessions, a lot more even, although it's not perfect, looks a lot better. Scarring on the back after only 3 sessions. So you can see that the scarring is still there, but it's definitely improved. Deeper acne scarring here, again after 4 sessions, responded amazingly well. And some pink stretch marks. So again, after 4 sessions, responded amazing. They pretty much disappeared for this client. Now, we do recommend that you read back through your training manual following your training, where you will find a lot more information about specific treatments, consultation and contraindications. Following your training, you must also complete a short test paper and send that back to your trainer so that we can get your certificates issued. We also run a number of clinical update training days, various courses, masterclasses and qualifications in conjunction with the University of Manchester and VTCT. So if you do want any more information on these courses or masterclasses, you can get in touch via the clinical email address, or you can check on Lynton's website. If you do have any clinical inquiries though, please do get in touch using the email, which is clinical@lynton.co.uk. And we also have a Lynton Facebook group, which is exclusive for Lynton customers, where you've got a great support network there. So you can find that if you go on the Lynton Lasers Facebook page, scroll across to groups, and you can click join. So please do get involved. There's a great little community on there, but like I say, if you do have any questions, please do get in touch via the email address, which is clinical@lynton.co.uk.